Welcome back to Wave 3 Listens. Sadly, we all will be affected by cancer at one time or another, so it's always exciting to hear about innovations, new techniques to battle cancer. Dr. Neal Dunlap is back here on the show. Been here before, and you've been very informative, Doctor. Welcome back.
Thank you.
And let's talk about this CyberKnife, because I think the more I read about CyberKnife, the more excited I am, because you hear about all the negative research on, chemotherapy and how do we, really get focused on the cancer area and not affect the rest of the body. And that's kind of what this is all about. Tell us a little bit about the CyberKnife and when is it most effective?
Right. I mean, really, cancer is a war, and we're trying to win this battle. And the more tools we have available to us, the better off we are as doctors and patients. Really, it's about giving people options. And the CyberKnife offers one of those options to people where they can truly have focused therapy directly to the cancer. And it's not for everybody, but in certain circumstances, it can be a very effective modality to prevent people from having to go through an operation or potentially chemotherapy.
As a guy here, I'm aware of the fact that it's Prostate Cancer Awareness Month. How can the CyberKnife help the battle against prostate cancer?
Well, great. I mean, the biggest thing I can emphasize for prostate cancer awareness is that men need to know their options. There are lots of men that actually never even need treatment for prostate cancer, but we tend to always want to do something about the diagnosis of cancer as soon as a person gets it. And it's kind of an uncomfortable thing for people to think about not doing anything about their cancer. But really, the CyberKnife offers a different modality for treatment. There are many people that have to go through a major operation for prostate cancer, or they have to go through prolonged radiation therapy for anywhere from up to 8 weeks of radiation, 2 months out of your life. The CyberKnife offers really a compressed course of therapy that can do it in up to 5 treatments and get a person back to living their life as quickly as possible. And that's really what cancer therapy is all about. What
is the training like with a CyberKnife? Now, you're seeing one of these in action here. I'll let you do the play-by-play, doctor, but I would think that someone has to go to really intense training to be able to operate a CyberKnife.
Right. So really, the CyberKnife is a team approach. It consists of physicians, physicists, radiation therapists that all work together to make sure that patients get the best treatment. Everyone goes out to training courses out in California to really become adept at using this equipment, and it's not something that just anyone can do. It really is a specialized type of training. We've had the privilege now of being able to treat our 100th patient here in Louisville, and so we've really given a great option to people here in this city. And that's really what the whole goal of bringing CyberKnife to Louisville was about, to give people expanded options for treatment of cancer.
You know, there's many reasons to be proud of being from Kentucky, but the fact that we are one of the leaders when it comes to lung cancer is not one of them. Right. When it comes to treating lung cancer, is the CyberKnife effective there as well?
Yeah, and the unique thing about the CyberKnife in that setting is that when you think about someone who has a tumor in their chest, when you breathe, things are moving up and down, left and right, and so it's really difficult to follow a moving target. And the CyberKnife has a unique system where it can actually track a tumor as it's moving in somebody's body. Most radiation therapy delivery devices don't really have that ability, and the CyberKnife can really just follow a tumor as it's moving up and down in a person's body by tracking the tumor with live updates as it's going through. That increases your accuracy of treatment. It also decreases potential side effects because you treat less normal stuff in a person's body.
When treating a patient with radiation or any kind of cancer treatment, when they breathe, that's kind of an obstacle. I mean, it's tough for you to really react. Right. The CyberKnife helps with that as well?
Correct. I mean, so really what this machine does, I mean, watch kind of how I do this, that when a person's breathing in and out, you can actually see the machine. It will be moving up and down and following the patient and with very subtle movements. It's an amazing thing to watch, and this is really the only piece of equipment on the market that can truly track a tumor moving in a person's body.
Now, as a radiation oncologist, what kind of cases do you deal with most often with the CyberKnife, and what is the future like for the CyberKnife?
Right, I think the future is very bright. I think we're just kind of scratching the surface in terms of how we can use this piece of equipment. Right now, the main indications are going to be for prostate cancer, lung cancer, and tumors that have spread to the brain. There are other applications that are currently being explored more, liver tumors, pancreatic tumors, kidney tumors, and people that have had prior radiation treatment where you're and have a recurrence, and where we need to really focus the radiation to prevent further side effects. So there's a lot of applications. There's even benign conditions that are being explored using it for that are not cancer related, and so that's still in the preliminary research phases, but I think that there are a lot of applications that are yet to come for this machine.
If you have any questions for Dr. Dunlap regarding the CyberKnife or perhaps a type of cancer and its treatment, 571-5263. I wanted to ask you about this, though. It seems to me that it varies from doctor to doctor as far as recommendations for men on prostate. I have read they say don't worry about it because by the time it hits you, it's going to move so slowly that you're going to die of old age. I've also heard you've got to keep a close watch on blood counts, etc. Tell me your recommendations, doctor. What is the state of the art when it comes to prostate cancer?
So we know that in the state of Kentucky this year, probably 3,000 men or so are going to be diagnosed with prostate cancer. So about 1 out of 6 men in their lifetime are going to get prostate cancer. So that's a lot. But the reality is that only 1 out of 30 or 40 people are going to actually ever die of their disease. And so it's a disease that we tend to overtreat, in all honesty. And so that leaves it open for options. And so men really need to understand that there are plenty of people that have a biopsy-proven diagnosis of prostate cancer that never need treatment because the disease will, number one, never cause them symptoms, and number two, will never take their life. They'll likely die of something else. So when you think about it in that regard, you have to start using your head when you're thinking about therapy. So number one is surgery good for everybody? And the answer is no, it's not always the best treatment. Number two, is chemotherapy really needed? And not, and most people know. Prolonged radiation, that is an option for a lot of men, but there are other options to compress treatment. So really, it's how can we get the best cure with the least amount of disruption in a person's life? And that's really what cancer therapy is about.
Wow. Dr. Dunlap, this is interesting stuff. Now, you talked to us about how it helps a doctor with the treatment of cancer, but what are some of the benefits, more benefits, for the patient? Obviously, I would think it's more intense, but by the same token, I would think it is less side effects? Because you can be more focused?
Yeah. Potentially, that's one of the good things about this machine. The treatment time itself are longer, but it's compressed, so 5 treatments as opposed to 40 treatments. We joke about the fact that a guy can come in and get their cancer treated in the morning and be at the golf course that afternoon. And so it really is about disrupting a person's life the least amount as possible. But yeah, there are increasing bodies of evidence out there that show that machines like this can decrease toxicity, and it may actually improve outcomes in some patients.
So folks who are watching this, obviously we've talked about lung cancer, prostate cancer. Maybe right now they're experiencing treatments, not reacting so well to it, and they're watching us, they're saying, will the CyberKnife be good for me? Other than lung cancers and prostate cancers, which we discussed, what other types of cancer would this be effective for?
Right, so we know that there are a lot of cancers that will spread to a person's brain. This is very effective at eliminating tumors in the brain. There are some people that can avoid having surgeries in those circumstances on their head. It can be good for patients that have tumors that recur somewhere in the body, for some tumors that spread to the liver, for some primary liver tumors, pancreatic tumors. So there's a broad application for this machine.
All right. Dr. Neal Dunlap is with us. We're going to take some phone calls. If you have questions, 571-5263. Exciting news in the battle against cancer. There's some information up on the screen right there. This is, as you can see, this is something you really need to pay attention. You might want to write down this number. Non-invasive, painless treatment of malignant and benign tumors. James Graham Brown Cancer Center, Part 1 of Kentucky One Health. I want you to check that out. Check out the number. Check out the website, too, if you have questions, and the phone number. We'll be right back on Wait 3 Listens.